How prepared is the U.S. to contain Ebola on our shores? That's the question Capitol Hill is facing Thursday as hearings are underway on the U.S. response to the Ebola outbreak so far. We'll have full details of the hearings later today on the News Hub with Sarah Murray. But right now, are nurses, those on the front lines of this country's Ebola response, adequately prepared? The second largest U.S. nurses union is calling for better infection control protocols and worker preparations for Ebola at every American healthcare facility. Candice Owley is chairperson of AFT Nurses and Health Professionals, representing 90,000 workers. She joins us now for our Washington bureau. Hi, Candice. Thanks so much for being with us.
Hi, great. Nice to be here.
Candice, how do the infection control protocols need to be strengthened right now?
Well, I think really we have to have clear protocols in place at every hospital and every healthcare venue, because even if you come into a clinic, if you have a temperature, all of those workers, frontline workers, need to have information on what the clear protocols are. What questions should they be asking, and then what action should they be taking? And while we're nurses, we care also about other people in the health facility having those same clear protocols, infection protocols and preparedness for all of the workers. And some of our hospitals and some of our facilities are really doing an excellent job, and others really need to step up their game on this.
All right, now the AFT is calling for dedicated teams of workers on Ebola cases. Now, how would that work? Would nurses volunteer to join these teams?
Yes, we think that it is a problem if you expect every single healthcare worker in every hospital to know how to fully take care of an Ebola case. So we think there should be a team dedicated in hospitals that is fully prepared and fully trained, at least in the initial stages, and they should be made up of volunteers. You know, there are very few hospitals we believe that will ever have a case, but there should be a team ready to take action and that will be knowledgeable, and we volunteer. And we absolutely know, and we've talked to our members, people will volunteer to be part of such training and such a team. We also support having the moving people, if possible, to the centers that are in the country that have already have experience with taking care of people who have Ebola and know fully how to both don their outfits, take their outfits off, and keep themselves and the patients fully protected. So it is a matter of having enough experience and having the right training and having people step forward as volunteers to be part of those teams. And not just nurses, as I say. Housekeeping is a big part of this, and physicians and even lab workers, people who are drawing bloods and so on.
So there has to be training on every level. It makes perfect sense. Now, congressional hearings are underway right now. Is there something the AFT is hoping to hear that will soothe your concerns?
Yes, I think there's a couple of things in terms of the congressional hearings. First of all, we think this is, I guess, an important moment to recognize that there have been cuts to the CDC and cuts to the public health system in our country. And if we didn't know it before, we need to know now that we have to put full funding into the CDC, but also funding into the local public health departments. Our public health nurses have really had their budgets cut and their numbers cut. And it's these public health nurses that have to go out and not just maybe follow Ebola, but they're following TB and other contagious diseases, and they've already been under great stress. So we want the Congress to recognize that they have a role in funding. We do also want CDC to have it communicated that CDC has to be absolutely clear and accurate with the information they provide, because they are the trusted source, and they must be the trusted source that we go to. We're also saying that we have to recognize that to really control this epidemic globally, we must put the resources into Africa. Had we paid attention and put resources into West Africa when this began, we would not be having these troubles today in the United States.
Okay.
So we can't only focus on the U.S. We have to also focus on Africa.
Very good point. Candice, thank you so much for joining us today.